Susan is a 44-year-old who runs a business from home. Through her interview, we showed the importance of summarising and pointing out discrepancies to progress the interview. We do this to uncover the essential element that has led to her physical symptoms caused by hyperventilation. Once the issue is made clear, we show the use of the structured problem-solving technique to resolve the core issue.
Well, I'm worried and anxious.
About?
I think I might have a brain tumour.
Sorry?
Well, I'm dizzy the whole time. I feel like I'm going to fall down everywhere.
Any other symptoms?
Well, no. Funnily enough, my arthritis is okay. I haven't even been, taking those pills that you gave me, and the palpitations seem to have gone, so obviously, I know I haven't had a heart attack or anything like that, but now I'm just dizzy the whole time.
Tell me about the dizziness.
Well, it started on the weekend. I woke with it on Saturday morning. Actually, it gets worse just after I wake up.
When you wake?
No, I'm fine. When I wake up, I'm absolutely fine, and then about an hour later it starts in, and then it just gets worse and worse and worse, and then it's with me the whole day, and it's with me now. I just think I might perhaps be developing some sort of a brain tumour, because they do say that that is one of the symptoms of a brain tumour, is dizziness.
Well, let's take a look at you. I'm going to ask you to pop up on the table.
Yeah.
And I'll listen to your chest, and I'll check out your nervous system.
Okay, fine. Thank you.
Well, I can't find anything wrong with your nervous system, so that makes a brain tumour unlikely. But I did count your breathing, and you're hyperventilating again, about 20 breaths per minute, and that's fast. Hyperventilation is a common cause of dizziness. So let's try that slow breathing thing I taught you last year and see if we can improve the dizziness. All right? And I want you to hold your breath for as long as you feel comfortable. Don't take a deep breath. Good. Now breathe out. And now I want you to breathe in and out slowly through your nose. Breathing in for 3 seconds and out for 3 seconds. And say the word relax in your mind as you're breathing out. Good. Now at the end of every minute, I want you to hold your breath again for as long as you can, and then go back into the breathing using the 6-second cycle. 3 seconds in and 3 seconds out.
Hyperventilation, excessive respiration that lowers carbon dioxide, results in a number of symptoms, the commonest being dizziness. The essence of the slow breathing technique is to teach people the effect of hyperventilation, show them how to measure their respiration rates as routine, and learn that they vary with anxiety, and to be able to apply the slow breathing technique to end the hyperventilation and hypercapnia. The technique is simple, but has to be practiced regularly so that it can be used automatically when one becomes anxious. A woman like this, who commonly gets upset about things, should practice it regularly forever.
Any better?
Yeah, a little bit. What could have caused the dizziness?
You mean what could have caused you to be upset? Well, what's going on in your life?
Nothing. Nothing out of the ordinary.
Well, keep up the breathing. Practice regularly, and I'm sure it'll help keep your dizziness under control. I can't believe there's nothing going on in your life if the hyperventilation has returned. Let's go through things. How's work?
Any clinician has to develop the ability to gently bring to the patient's attention things that don't add up. The aim is for the patient to think about the paradox and come to a better understanding. The ideal way to do it is to act puzzled. I'm not sure I understand. Or, could you explain? The doctor in this case does this all the time as she seeks to get to the bottom of this woman's psychosomatic symptom. She knows to do this because the patient has a long history of reacting to difficulties with somatic symptoms.
Natalie and I are not speaking is an important clue to the likely stressor, but the direct question has not worked.
Works great. Yeah, it's going great guns, actually. I like the organisation, keeps me busy, and people seem to like working for me. Amazing, isn't it? I look on it as a memorial to Gary because we actually bought the business with the compensation from his accident.
And that was...
The accident about 5 years ago.
Oh, that's right. What about your husband? How's he?
Jack? He seems all right. I think he's behaving himself.
What about your other kids? Gary was your youngest, wasn't he?
Yeah, Sam's all right. He rings me every Monday night, tells me he's okay. I mean, it's not the same as seeing him, but... And Natalie and I, well, we're not actually speaking at the moment, so I only hear about her indirectly. I do worry about her overdosing on drugs, you know, some of the parties she goes to, but anyway, Sam and Jack tell me I've got nothing to worry about on that score, so...
Why aren't you and Natalie on speaking terms?
It's been going on for a long time now. Anyway, look, I will take advice with that deep breathing thing, and thank you very much for your time.
Do you really think we've got to the bottom of this? I mean, isn't there anything else that's happened recently?
Well, we did lose out on a cleaning contract, but I don't think that's really bothering me.
Anything else happened?
No. Oh, yeah, the dog died last week. Jack thinks it was poisoned or baited or something. I mean, I don't know. I haven't had time to worry. I've been too concerned about this dizziness, you know.
Do you think the two things could be related?
Oh, not really. I mean, it was Jack's dog. I mean, he was a bit of a mongrel, really. I wasn't overly attached, if that's what you mean.
But the dizziness began straight afterwards?
Yeah. Yeah, it did. I suppose I was upset by the dog's death. I don't know. Not because of the dog, just because it was another death in the family. I mean, I've had a few sudden deaths, and you know, it took me quite a while to get over Gary's. So I suppose even it wasn't just about the dog. It was like another member of the family go.
Yes. Yeah, but what I can't understand is how that's making you hyperventilate.
Well, I don't know. I mean, all I just know is that when the dog got poisoned, I started thinking about Natalie dying of a drug overdose. So I don't know.
Well, why don't you see her then?
Oh, well, what good is that going to do? She won't listen to me. She won't even look at me.
As the doctor is clearly getting somewhere, now is the time to summarise. As much to consolidate what she knows as to have the patient confirm the salience of what they're both talking about.
Okay, just let me make sure I've heard this right. 2 weeks ago, everything was okay. Your palpitations are gone, your arthritis wasn't troubling you, your husband and you were okay, and you were preoccupied with running your business. Then your dog died, and you feel you're sensitive to death in the family because of your past experiences. You're fighting with your daughter, and you won't talk to her, but mostly you're worried that something bad might happen to her. And now you feel dizzy all the time, and you're worried that you might die of a brain tumour. Is that right?
Yeah, but I don't actually think it's connected to the dog getting baited.
So what is it about?
Well, it's about my dizziness.
We've seen that that's almost certainly due to hyperventilation, and you know how to control that. I'm sure that dizziness isn't the key thing.
No, well, okay, I'm not actually dizzy now, so it can't be a brain tumour, but I'm sure it's not about not seeing my kids. I mean, I could ring my son up and ask him to come over for tea if you think that's going to help.
Do you think that's the main issue?
No. I mean, he'd probably come if I asked him. I haven't seen him for over a month, but, you know, boys are pretty casual about that sort of thing.
Well, is there another issue?
Well, yes, I mean, I am upset about not seeing my daughter. If she lived overseas, you know, it would be a different thing, like we would write or we'd ring or something, but the thing is, she lives in the next suburb, and I see her down the shops. She won't even look at me.
She won't even look at you?
Well, I don't know. She and I are pretty similar in many ways. Like, she even looks like the way I did when I was her age, but... Oh, since she started moving in with that fellow of hers, I mean, he's around her the whole time. He just hovers around her. And that's something that my first husband did to me, just hovering the whole time. and I think that he may be abusive and possibly violent. And anyway, I said that he wasn't welcome in the house and that she would be a hell of a lot better without him, and I didn't want to talk about it anymore.
When was this?
4 months ago. Yeah. Needless to say, it didn't go down terribly well. She cut me off, absolutely cold. Anyway, I just threw myself into the job. I mean, I know I shouldn't have interfered, but God, I mean, I've always been completely honest with her, and I just couldn't bear it if that boy turned out the same.
And what makes you think he's the same as your first husband?
Nothing specific. Oh, look, she says he loves her, and, you know, he's never raised his hand against her yet. But I still worry.
But that's you, isn't it? And you've got no real evidence.
Not specifically, no.
But this really makes you upset.
Yeah, I'm worried sick.
Exactly. So let me ask you this again. Going back over all the things you've told me today, what do you think is your main problem?
Making peace with my daughter, I suppose. But how am I going to do that when she won't even look at me?
Why don't we look at a structured problem-solving method, see how we can deal with this. I want you to write down exactly what you think is the main problem.
The first and hardest step in structured problem solving is to have the patient identify the problem or goal. Identified problems need to be single, specific, and potentially solvable. Once the problem is identified, the patient writes down all possible solutions, even impractical ones, for they sometimes contain the germ of a good idea. List the solutions without evaluation. This step is called brainstorming. Next, have the patient assess the main advantages and disadvantages of each solution, and then choose the best or most practical way to begin to solve their problem. The next step, in which the patient plans how to carry out the chosen solution, is vital. Real problems are difficult to overcome, otherwise they wouldn't be real problems. So the patient should write down the steps, list the resources needed, and practice the difficult conversations and tasks. Remember that anxiety robs capacity, so if it's not written down or rehearsed, the patient could forget what to do. Then let them go and do it, and at the next consultation, review progress. Focus on achievement first. Identify what's been achieved and what is still to be achieved. Then go through the sequence again. There's nothing like a failed attempt to make problem identification easier. Oh, and be pleased at any progress. Say you're pleased with any progress.
Okay. Now I want you to list all the things that you think might lead to solving it.
What now?
Okay, let's have a look. Ring her and invite her over. Get her brother to bring her over. Write a long letter apologising and saying how much I love her. Have a family party and invite them both. Get hospitalised. Send flowers. Okay. Now I want you to say the disadvantages and advantages of each one.
Well, she's too offended to accept flowers or an invitation, so that's out. She'd probably come over if brother asked her instead of me, but it'd be a pretty tense dinner. No, I have to make my peace with her before we have dinner. That's all there is to it. I mean, I started the whole thing, so it's up to me to fix it.
Okay, well, let's use the last part of this form to plan a solution.
Well, I know she goes down to the shops on Thursday, so if I wrote her, apologised and arranged to meet her there, maybe it'd work out.
Good. We'll come back next week and let me know how things went. And take care of that brain tumour.
What brain tumour?
At the beginning, we said good interviewing was an essential part of good practice. These techniques are simple, practical, and fit well in general practice. Good luck with them. If you want to be in touch with us, our webpage address will be shown in the closing credits. Remember the impossible patient we started with? Well, let's see how they're going.
So I often lay awake at night for hours wondering if it's all worth it. Of course, if the sleeping tablets you prescribed for me actually worked, I'd be asleep instead of lying there worrying.
Stop. Now let me tell you what I've heard. You say you've had a relapse and the medication isn't working for you.
Well, you're the first doctor that's ever listened.